Thermoplastic-based systems assist in providing accurate positioning and immobilization and are comfortable, easy to use, and cost-effective. During this presentation, we'll demonstrate 3 CIVCO head and neck positioning systems, as well as related treatment accessories. Our Type S, PosiFix, and Uniframe systems each offer a high degree of patient stability with ease of use for the clinician. Most head and neck treatments can be performed on any of the systems, although some advanced techniques are best performed with the Type S or PosiFix. Both the Type S and Uniframe systems feature a constant frame docking approach. This ensures the mask material is always tethered to the docking frame, resulting in a more uniform tension throughout the mask. The PosiFix system allows a clinician to drape the thermoplastic material over and around the patient. CIVCO's head and neck positioning accessories increase the adaptability of each system. After an immobilization system is selected, the patient setup simulation begins. Once simulation is completed, the mask is marked to assist in creating a reproducible setup. Then the treatment plan is created. Once planning is complete, the patient is repositioned on the treatment table and the treatment cycle begins. This video will review the patient setup section of the process. We'll begin with a few basic instructions and then demonstrate the Type S, PosiFix, and Uniframe systems in order. Finally, we'll discuss advanced head and neck treatment accessories, including the AccuForm cushion, individual head support, and precise bite repositioning. CIVCO head and neck products are designed to handle a wide variety of patients in therapeutic situations, and there are some basic instructions that apply to all product use. In all cases, CIVCO products should only be used by order of a physician. All disposable products are intended for use on one patient only and should not be reused for additional patients. Disposable products include, but are not limited to, all thermoplastics, AccuForm cushions, the individual head support, and the precise bite reposition. To help minimize potential shrinking of any mask, ensure the mask is completely cooled before removing from the patient once formed. The cooling process can be quickened by applying CIVCO's Cool Mitt or a cool damp towel to the mask. All masks should be removed from the patient carefully, keeping in mind any sensitive areas on the patient which the mask may contact during removal. Always clean the mask as necessary and store the mask in a clean, designated area. The Type S offers unsurpassed versatility and ease of use. Providing stability for the head, neck, and shoulders, the Type S extends off the couch top for treatments in a 360-degree arc. The Type S system features minimal attenuation and is CT compatible, and accepts head only or head, neck, and shoulders thermoplastics, and is indexable with a 2-pin lock bar. To begin setup, index the lock bar to the tabletop, then align the Type S overlay with a lock bar and place the overlay onto the tabletop, connecting with the lock bar. If extending the overlay beyond the table, secure the overlay via the Velcro safety strap included. Be sure never to extend the overlay beyond the board's prominently displayed safety marker. Once the overlay is securely positioned, select the appropriate head support and mask for the patient's setup. The Type S accepts Silverman, AccuForm, the individual head support and back lock head supports, as well as PosiFix head supports with an adapter plate. In this case, we are using the Silverman head support. With the head support in place, position the patient. In order to guarantee mask clearance, check that the patient's shoulders are within the borders of the base plate. On the standard Type S board, this may require using a shoulder retractor system on certain patients. If using the Type S fixator, make sure that the patient is positioned so that the shoulder retractor setup markings can be exposed. Align and pre-position the patient. We are then ready to proceed formation of the thermoplastic mask. For this demonstration, we'll be using the IMRT reinforced head, neck, and shoulders mask. For warming times and temperatures, refer to the thermoplastic heating instructions in the CIVCO instructions for use. After the mask has been heated for the appropriate amount of time, carefully remove the thermoplastic mask from the water bath. Swiftly dab it to remove excess water, and then begin pulling it over the patient, being attentive to molding and forming it to the pronounced bony landmarks of the patient's contour. The nation and the mandible region serve as reliable contour points. If using a full head and shoulders mask, Be careful that the mask does not gather in the neck section, but rather remains smoothly contoured against the neck. Perform final corrections, taking advantage of the mask's pliability before hardening. If using the fixator, once the mask has completely cooled, begin applying the longitudinal pressure to the shoulders. Continue to apply pressure until the desired retraction is achieved. Record the retracted positions on the setup sheet provided. Mark the mask as needed, and begin simulation. Once the simulation or daily treatment is complete, release the mask from the base plate by gently pulling the safety pins upward. Carefully lift the mask up and off the patient. CIVCO's ZenTek thermoplastic material offers another immobilization option. ZenTek forms to the patient's features through a smooth draping method, resulting in enhanced facial contouring for improved repositioning and fixation. ZenTek masks combine rigidity with an easy forming process, require less warming time. The constant frame allows ZenTek thermoplastics to be formed by one person. On many Linac treatment tables, the Type S head extension may be a desired option. If so, simply attach the Type S extension to the exposed head end of the table by angling the extension upward and inward, aligning the extension to the table's docking mechanism, and leveling flush. The extension is now ready for both a patient and accompanying Type S mask supports. The Type S system provides a high degree of stability for the head, neck, and shoulders. The system has minimal attenuation, so it is ideal for IMRT and conformal treatments in a 360-degree arc. The numerous headrest and thermoplastic options provide a setup option for almost any patient. We'll now discuss the CIVCO PosiFix head and neck system. CIVCO's PosiFix head and neck positioning system is highly adaptable. PosiFix base plates accommodate a wide variety of head-only and head, neck, and shoulder thermoplastic masks. Available base plates vary from basic acrylic head base plate to a more sophisticated carbon fiber IMRT base plate. The PosiFix system is a 2-pin ready and can be indexed to the table with a lock bar. To begin setup, index the lock bar onto the tabletop, then align the PosiFix base plate onto the lock bar. If desired, the CIVCO couch-top cover can be positioned against the base plate for added patient comfort. Once the base plate is securely positioned, select the appropriate PosiFix head support and mask for the patient's setup. 3 and 5-point PosiCast thermoplastics are available in a variety of types. Traditional PosiCast provides a soft polyurethane coating on both sides of ultimate patient comfort and handling. PosiCast Plus has polyurethane coating on the side that comes in contact with the patient and a smooth outside for easy marking, and PosiCast Lite includes a smooth coating on both sides. Here we are using the PosiFix 2 base plate and a PosiCast 3-point thermoplastic mask. PosiCast thermoplastics should be heated in a water bath set to 70 degrees Celsius, 158 degrees Fahrenheit for 1 minute. CIVCO offers an array of head supports compatible with the PosiCast system. These head supports range from the PosiFix supine head supports to the PosiFix contour head supports, which provide a deeper contoured fit. PosiFix prone headrest and PosiFix pediatric headrests. In addition, custom molds such as AccuForm and individual head support are also compatible options. With the desired head support in place, position the patient onto the base plate. Align and pre-position the patient. Next, carefully remove the thermoplastic sheet from the water bath, being mindful not to allow the sheet to fold over upon itself. Swiftly dab the mask to remove excess water. Align the mask over the patient so that the mask's opening falls upon the patient's upper lip region. Dock the lateral handles of the mask to the base plate, using the white positioning points as a lining guide. Secure the handles with a quick fastener system. Next, capturing the superior end of the mask's material atop your hand, gently stretch the material and handle down towards the base plate, again using the white positioning points as a guide. Secure the handle with a quick fastener system. Once all 3 handles are securely docked, gently stretch the mask's opening wide to allow protrusion of the patient's nose through the mask. Now, begin contouring the mask to the nation and chin, using a gentle forward motion to fully form the mask over the chin, in order to set the mold and to prevent the thermoplastic from reverting to its original shape. holding the mask in place for a few seconds. If desired, additional repositioning points can be formed to reference the patient's ears. Be mindful to perform final alignment for the patient before the mask hardens, usually within 5 to 10 minutes. Once a mask is firm and completely cooled, mark the mask as needed and begin simulation. Once the simulation or daily treatment is complete, release the mask from the base plate by gently pulling the quick fasteners upward. Carefully lift the mask up and off the patient. Both the carbon fiber PosiFix 2 and the acrylic PosiFix 4 are designed to accept a 5-point PosiCast mask, in addition to the standard 3-point version. Initial setup is identical to the process just demonstrated. 2 people are recommended to perform this task properly, with 1 person assigned to the head section of the mask and the other to the shoulder region during fabrication. To fabricate a 5-point mask, have the technician designated to the head end capture the superior end of the mask's material, then gently stretch the material and handle down towards the base plate, using the white positioning points as a guide. Secure the handle with a quick fastener system. Once the head region is securely docked, begin to address the shoulder region. Initially, each technician will work the lateral side, forming thermoplastic around the shoulder with a slight S-turn movement. This movement will ensure that the shoulder is properly captured. If using the PosiFix 2 base plate, be sure to dock the handles down into the holes nearest to the patient's shoulders. Once the shoulder handles have been docked, if using the PosiFix 2 base plate, be sure to dock the handles down into the holes nearest to the patient's shoulders. Once the shoulder handles have been docked, each technician will now turn their focus onto their specified area, one forming the mask at the head, while the other concentrates on pushing the shoulders down. Setup of the PosiFix system is complete, and the patient is now ready for simulation or treatment. Once simulation or treatment is complete, release the mask from the base plate by gently pulling the quick fasteners upward. Carefully lift the mask up and off the patient. The PosiFix system provides an efficient system for head and neck positioning and fixation. PosiCast thermoplastics create a highly contoured patient mask with minimal shrinkage for increased patient comfort. With many headrests and thermoplastic options, PosiFix is a versatile head and neck positioning option. The third CIVCO head and neck positioning system is a uniframe system. The uniframe head and neck fixation system provides rigid immobilization for enhanced image quality.
This is the one we'll be using here in the lab.
As well as consistent patient posture. Available in carbon fiber or acrylic, the indexable base plates feature a cutout area under the head support for visualization and treatment. They utilize easy-to-use swivel clamps for locking down a variety of thermoplastic mask options. To begin setup, place the base plate on the tabletop, aligning it onto the 2-pin lock bar. Once the base plate is securely positioned, select the appropriate head support and mask for the patient's setup. Uniframe is compatible with Timo, Silverman, and AccuForm cushions. For this demonstration, we will be using the Silverman headrest with an IMRT reinforced mask and a carbon fiber base plate. For warming times and temperatures, refer to the thermoplastic heating instructions in the CIVCO instructions for use. With the head support in place, position the patient onto the base plate. Align and pre-position the patient. Next, carefully remove the thermoplastic mask from the water bag, swiftly dabbing it to remove excess water. Begin pulling the mask by first capturing the patient's chin and then align the mask over the nasal region so that the reinforced strips rest partially down on the nose and over the brow. Once aligned, pull the mask over the patient and dock the frame to the base plate. Mold and form the mask to the pronounced bony landmarks of the patient's contour. Perform final corrections, taking advantage of the mask's pliability before hardening. Then allow the mask to cool. Mark the mask as needed and begin simulation. Once the simulation or daily treatment is complete, release the mask from the base plate by turning the swivel clamps. Carefully lift the mask up and off the patient. The Uniframe is an industry standard and one of the most popular systems available. It provides a simple, easy-to-use head and neck immobilization option. The variety of headrest and thermoplastic options provide patient customization for each head and neck patient. Finally, we'll discuss and demonstrate 3 advanced head and neck accessories. In this section, we will cover AccuForm cushions, the individual head support, and the Precise Bite patient repositioner. Both AccuForm cushions and the individual head support are custom-made, patient-specific head supports. Each provides enhanced patient repositioning in the superior to inferior plane, as well as custom contouring for cranial shapes not sufficiently cradled by the standard head supports. As each device is fabricated specifically to the patient, it becomes a dedicated, permanent mold and is not reusable for any other patient. We'll begin the demonstration for the AccuForm cushions. Select the appropriate cushion size and remove the cushion from its airtight package. The cushion should not be removed from its
We also have some of these that you'll get to use.
package until the time of use. The cushion demonstrated here is 20 by 25 centimeters. Civco also carries cushions in a wide range of sizes. Mist the cushion thoroughly with a spray bottle and gently knead the cushion to ensure proper dispersion of the water throughout. Wipe off any excess water. The AccuForm cushion may also be used in combination with a Silverman head support. If using a standalone AccuForm cushion, be sure to have the AccuForm indexing bar in place. Next, position the cushion into either the indexing bar or the base plate and pre-shape the cushion to help guarantee proper flexion. Position the patient onto the cushion and begin forming the cushion around the crown and neck region of the patient. The goal is to form the desired neck extension of the patient, while additionally creating a cranial contour that will enhance superior to inferior positioning accuracy for patient placement. Be careful to make sure the cushion will not interfere when the mask is docked down to the base plate. Once the AccuForm cushion is sufficiently stable, usually within 3 to 5 minutes, continue with the patient simulation setup. When the simulation is complete, be sure to place a patient identification mark on the AccuForm cushion. The AccuForm cushion is now ready for the treatment cycle. A paper drape may be used on a daily basis for sanitation. We'll now demonstrate formation of the individual head support. The IHS is available in 2 different shapes. The neutral shape for setups requiring a more level position for the patient's cranium, and the hyper shape for those setups requiring a more pronounced flexation of the patient's chin and neck. Select the shape appropriate to each individual setup. Here, we'll be using the neutral shape, IHS. Each IHS kit consists of a base plate, impression foam, and a cloth-covered thermoplastic sheet. Bases are available in both Type S and PosiFix compatible forms. The impression foam provides the initial support and contour, and the thermoplastic sheet provides a final support and contour for the IHS. In simulation, position the IHS onto the base plate and pre-position the patient onto the impression foam without compressing the foam, ensuring proper patient superior to inferior placement. Then carefully lift the patient up off the impression foam. Keeping the patient superior, the thermoplastic sheet should be placed in the water bath at this time. Remove the thermoplastic from the water bath and carefully dab away excess water. Dock the sheet onto the base plate, using the protruding prongs as docking guides. Once the sheet is secured, guide the patient onto the IHS and carefully compress the patient's head into the impression foam via the forehead and chin, using a gentle but firm downward motion. This compression will cause the thermoplastic sheet to form around the patient's posterior cranial side.
Not sure that's comfortable.
To avoid creating a sideways impression with the patient's head, it is best to apply the pressure from directly above the patient. Allow the sheet approximately 5 to 10 minutes to cool and harden with the patient upon. After this, the remainder of the patient setup can proceed as required. When combined with an advanced frameless fixation system, the IHS can play an integral part in the department's stereotactic cranial treatment program. The Precise Bite is a custom positioning accessory designed for enhanced positioning accuracy and increased immobilization of a patient within a thermoplastic mask. The Precise Bite is available in standard and small sizes, with or without a tongue depressor. Each Precise Bite consists of a moldable mouthpiece that, once heated, conforms and registers to the patient's upper teeth. The Precise Bite's unique docking assembly affixes the formed mouthpiece to the thermoplastic mask. To begin setup, remove the backing plate from the mouthpiece assembly, keeping the backing plate within reach. With the patient in initial setup position on the head support, immerse the mouthpiece section of the Precise Bite into boiling water for 35 seconds to soften the mouthpiece into a moldable state. For warming times and temperatures, refer to the Precise Bite heating instructions in the CIVCO instructions for use. Once fully heated, carefully remove the Precise Bite from the hot water and dip it into a container of cold water for 3 seconds to prevent burning the patient's mouth. Carefully insert the mouthpiece into the patient's mouth, visually checking that the mouthpiece is properly engaged onto the upper teeth and that the lips are closed naturally around the docking stem. The patient should bite down on the Precise Bite. Once formed, remove from the patient's mouth, dip into cold water for 10 seconds. The Precise Bite is now fully formed and set. Reinsert into the patient's mouth, and the Precise Bite is now ready to be joined to the mask. Begin pulling the mask over the patient, docking the frame securely to the base plate. Swiftly clear the thermoplastic over the mouthpiece's tines, clearing the way to engage and lock the backing plate. You will hear a clicking sound that signals it is secured. The thermoplastic can also be formed up and around the lower plate to add additional stability to the Precise Bite. However, this will result in the Precise Bite being permanently affixed to the mask. After this has been accomplished, move to the other areas of the mask, such as the chin and nasion, and complete the contouring of the mask to ensure optimal setup. To clean the Precise Bite, use an approved oral antiseptic. For advanced head and neck setups, CIVCO offers AccuForm cushions and the individual head support for custom cranial contouring. The Precise Bite enhances positioning accuracy and increases immobilization within the thermoplastic mask. All 3 devices can be used in conjunction with all the systems presented here today. During this presentation, we've demonstrated CIVCO's 3.
We'll stop there. So, the one thing that nobody mentioned on that particular video is that you have to make sure that your patient is straight.
I was looking at the end, I'm going,
There's no use in making a mask if the patient's head's like this or like this. Have to make sure that the patient's head is straight. And in CT, you have some lasers which you use to make the patient's head straight. So we have the U-frame masks, which we will use. We will also have the cushions for the head. It's not a CIVCO cushion, but it's the same type of thing, only with a different manufacturer. And instead of putting these things in hot water, we put them in a little oven, which does the same. It just makes it warm and dry instead of warm and wet. So basically it's the same thing, only we use the oven. It makes it a little longer because it takes more time to warm it up in the oven than it does to warm it up in a water bath. But then the water bath has to be cleaned and sanitized at least once a week, whereas the oven doesn't have to be. Questions on the head and neck?
let's say that when I'm taking the mask out, I do something on accident and it gets messed up a little bit. Do you?
You get messed up in how?
Like if it gets stuck on something and then part of it folds off, or
Yeah.
it folds over on top of each other. I saw
Right.
some of those bigger masks, they look like where you needed 2 people.
Yeah, you
If
do
it-
need 2
If
people.
it folds over on top of itself, does it stick?
Yeah.
So do you put it back in the water?
Nope, you
That-
chuck it
that
out
was
and
done.
start again.
Start again with another one.
Remember, these masks, especially the big ones, are about $150 each.
Right. I figured they were not cheap.
So, yeah.
Better
So-
get it right.
So you do your best not to do that, and most of the time we prefer to have 2 people even making the smaller masks, because it's, one, it's easier, and two, it helps to keep the patient straight, because if you're trying to do doing it one way, the patient can sort of nod their head this way. But if you've got one person on one side and one person on the other, and you're pulling down at a normal rate, then the patient's head tends to keep still and straight. And certainly with the large mask, you have to have two people, at least two people, in order to do that. And you have to be quick, because these masks harden rather quickly. So you have to make sure that you mold them into the patient as fast as possible and as accurately as possible before they harden. Because if they harden and you're not completely satisfied, then guess what? You throw it out and start again, which is not what you want to do.
Do they harden faster in a colder room?
No,
No.
no, it's just the heat goes away from them. The colder room doesn't hurt, but they show you the cool mitt, which is really nice, but it's an extravagance, shall we say. You don't need that. You basically get them positioned, get especially the nose and the eyes positioned correctly, and then just have them lie for a little while. And then, of course, the problem of patients with claustrophobia. But you have to do it. And believe you me, you can get a patient who has claustrophobia through this treatment. You just bear with them and try. If it takes you talking to them all the time while they're having it done, and talking to them all the time when they're having the CT and the treatment done, that's what you do. But making the mask and doing the CT is the longest time they'll have to lie, because you have to do the mask first, let it cool, and then do the CT without taking the mask off. If they can get through the CT and the MRI, they can do the treatment. If they've been through an MRI, they can do this treatment. If anybody's ever been through an MRI, they know how claustrophobic it is. If they can survive the MRI, they can survive our treatment. Questions so far? Okay. It's time.